that was a truly captivating performance showcasing the rich cultural heritage of Sri Lanka. And now, to officially welcome you all to this prestigious inauguration ceremony, may I cordially invite the conference chair of the Global Public Health Summit 2025 and the president of the College of the Community Physicians of Sri Lanka. Put your hands together to Dr. Kapila Jayaratne.
Good evening. Guests of honor, Her Ladyship, Mrs. Murdu Fanadu, President's Council, Honorable Chief Justice, Professor Krishanta Jai Abesena, Honorable Minister of Science and Technology, our special guest, Professor J. Jayalal, President of the Commonwealth Medical Association, Dr. Nihal Abesingha, Member of the Parliament, Professor Indika Karunatilaka, Vice Chancellor of the University of Colombo, and Secretary General of the Asia Pacific Academic Consortium for Public Health. Our keynote speaker, Dr. Zivai Murira, Professor Dulitayan Fernando Orator, Dr. Renuka Jayatissa, Additional Secretaries of Ministry of Health and other Ministry of Health officials, colleagues from UN agencies, WHO, UNICEF and UNFPA, Chairman, National Dangerous Drug Control Board, Dr. Indika Vaninayaka, representatives from other professional colleges, past presidents, fellows, council members, members of College of Communications of Sri Lanka, distinguished invitees. It is with immense pride and deep humility that I warmly welcome all of you to the Global Public Health Summit 2025. We hold this in conjunction with the 30th annual academic sessions of the College of Communications of Sri Lanka. Public health serves as the often unseen engine behind longer lifespans, healthier families, and stronger, more resilient nations. You can see here the large number of people in Sri Lanka who fall ill, seek outpatient care, attend clinics for chronic diseases, require inward care in hospitals, and ultimately lose their lives. Its core mission is to prevent illness, avoid avoidable deaths, extend life expectancy, lessen the strain on healthcare systems, and empower communities to take charge of their own health, that is public health. In doing so, it transforms the focus from treating disease to preventing it, and from managing illness to promoting overall well-being. The first professional association of public health officers in Sri Lanka was the Society of Medical Officers of Health, which was established during the British colonial era on 26th of November 1927. It was established with a view to safeguarding interest of its members and promoting public health in the country and stimulating interest of the public in matters relevant to their health. As a premier professional body in preventive medicine, we have been privileged to lead national initiatives build research capacity, and strengthen health systems through science, service, and solidarity. The present Council of CCPSL has undertaken a range of high-impact academic and advocacy initiatives aligned with its mission of ensuring every baby thrives, every community flourishes. In partnership with Dr. Hannah Blencoe from the London School of Hygiene and Tropical Medicine, CCPSL conducted a specialized training workshop on stillbirth and bereavement care and produced a policy brief on Sri Lanka in the prevention of stillbirth, preterm birth, birth defects and neonatal deaths, aimed at strengthening national frameworks. A key highlight was the successful hosting of the 19th annual conference of the International Stillbirth Alliance, that is ISA 2024, which brought together global experts and policymakers to address stillbirth prevention and maternal health policy. Complementing with this, CCPSL organized a deeply moving stillbirth memorial service, offering a platform for remembrance and healing for affected families. The college also conducted an innovative academic engagement through a reflective storytelling night which captured the rich history of Sri Lankan public health through personal and professional narratives, fostering intergenerational learning and inspiration among participants, and a creative digital photography program for public health professionals designed to enhance visual communication skills and empower participants to effectively capture and convey public health messages through impactful imagery. Further cementing its policy leadership, CCPSL convened a high-level dialogue with the Honourable Minister of Health to advance policy reforms on termination of pregnancy in cases of congenital lethal anomalies and to strengthen maternal, newborn and child health services. CCPSL sustained its commitment to academic capacity building through a series of continuing professional development programs, a national workshop on manuscript writing, and the prestigious Dr. F.A. Wickramasinghe Oration 2025, which focused on adolescent and youth health. Monthly journal clubs and young community physicians forums offered continuous professional engagement and knowledge sharing on current public health priorities, including vector-borne diseases, NCDs, and advanced statistical methods. Media outreach remained a cornerstone of CCPSL's public engagement strategy, with two impactful media seminars, one addressing emerging public health challenges in Sri Lanka and the other commemorating World Birth Defects Day, spotlighting congenital anomaly prevention. These coordinated academic, policy and communication efforts reflect CCPSL's leadership in driving evidence-informed public health action across Sri Lanka. In collaboration with the Family Health Bureau and John Pearson Hospitals, we conducted the innovative program Rhythm to Life to engage adolescent school children through music-based interventions, promoting healthy relationships, goal setting, and resilience against challenges such as risky sexual behaviors, drug use, and violence. CCPSL also disseminated engaging and culturally resonant social media messages to the general public during the Aurudu season, promoting lifestyle modifications and healthy habits in alignment with festive traditions to encourage wellness and preventive health. ComHealth Fest emerged as a novel and vibrant strategy to engage the public in understanding and celebrating public health by blending education with creativity through interactive booths, art exhibitions, cultural performances, and health screenings. It transformed complex health messages into accessible, community-driven experiences. A key highlight was the health walk, which brought together stakeholders from across the health sector, academia, and the community in a powerful demonstration of unity and collective commitment to wellness. The fest successfully showcased how public health can be made visible, relatable, and inspiring to people of all ages, reinforcing the importance of prevention, wellness, and community empowerment. Apart from these initiatives, CCPSL made numerous appearances across various electronic media platforms and organized engaging activities such as friendly cricket match and a talent show to showcase the diverse talents of our members. Over the past few months, we have strategically rebranded the CCPSL to enhance the visibility and bring renewed glamour to the public health profession, positioning it as a dynamic force in shaping national health discourse and innovation. My sincere appreciation is extended to the Council of CCPSL and the dedicated group of postgraduate trainees for their steadfast support, professionalism, and collaborative commitment, which have been pivotal in successfully implementing the college's initiatives and advancing its public health mandate. Organizing a global summit on public health holds profound significance for Sri Lanka at this critical juncture as the country grapples with a complex array of public health challenges, from rising non-communicable diseases and emerging infectious threats to the health impacts of climate change, mental health crisis, fertility decline, and widening health inequities. The need for coordinated, evidence-based, and innovative responses have never been greater. Our theme this year, delivering high-quality care in resource-limited settings, is both timely and urgent. It reminds us that innovation, compassion, and collaboration are not limited by resources but are inspired by them. And it reinforces our shared goal to ensure that every baby thrives and every community flourishes. Let me extend a most respectful and heartfelt welcome to Her Ladyship, Mrs. Muthu Fernando, Honorable Chief Justice of Sri Lanka, and our own colleague, Professor Krishanta Besena, and Honorable Minister of Science and Technology. We are truly grateful for your presence. A very special welcome goes to Professor J.A. Jayaratne, President of the Commonwealth Medical Association. I am equally honored to welcome Professor Indika Karunathilaka, Vice Chancellor of the University of Colombo and Secretary General of the Asia Pacific Academic Consortium for Public Health. I am also deeply honored to welcome our keynote speaker, Dr. Zivai Murira, and our Professor Dulita and Fernand orator, Dr. Renuka Jayatissa. It's with great pleasure that we warmly welcome Dr. Nihal Abesingha, esteemed past president and fellow of the CCPSL. We are honored to host delegates from across the globe, partners from WHO, UNICEF, UNFPA, NEDCB, Family Planning Association, the Ministry of Health, academic institutions, and civil society. Your commitment strengthens our resolve to move from dialogue to action, and from science to solutions. Let me conclude by thanking our organizing committee, collaborators, and everyone who made this summit possible. I welcome you all once again to what promises to be an inspiring and transforming gathering. May this summit be a catalyst for new ideas, meaningful partnerships, and lasting impact on public health, both in Sri Lanka and beyond. Thank you.